October is Breast Cancer Awareness Month, and while the statistics can be scary, early detection truly saves lives. Here to talk about how women can take charge of their breast health year-round is Dr. Sasha Douglas. She's a breast surgeon at St. Francis Hospital. Thank you so much for being with us.
Yes, thank you so much for having me.
So, it's the most common cancer in American women. We're looking at statistics now about 1 in 8. Is that right?
That's correct.
I mean, I think everyone knows someone who has been affected. In fact, my cousin, who's only my age, just got, thankfully it was early detection, but she just found out that she has some cancer. So, you know, I feel like we're all touched by this, and it's incredibly common, but we can do something about it.
Yes, for sure. This is why mammograms are so important, because this is the best way that we have for detecting early. And when we detect breast cancer early, it's the most treatable at that point. So this is before we can even feel it on exam.
Yeah, and I know we have the necessary of once-a-year mammograms. What's the current recommendation on when? I think sometimes women get confused about that.
Yeah, that's a really good point. So everybody needs to talk and have an individualized discussion, because people who have dense breast tissue, people who have a family history or a genetic predisposition may need to get more screening and then even additional imaging, sometimes with like an ultrasound or an MRI.
Okay, and so generally it's going to be, at least for me, I was told to go every year after 40. So we can do that, and then it depends on family history too. Are you automatically going to need extra screening if, say, your mother or sister had it?
Usually with first-degree relatives, we do recommend that. We do have referrals to genetics counselors who can really help, and then sometimes do a blood test to see.
So yeah, talk about it. There's I've never heard of a blood test, so now there's even more genetic type testing, new frontiers in this, I guess?
Yeah, so genetic testing has become a lot more available, a lot more cost effective, so we're recommending it a lot more these days.
Okay, and so if you're at higher risk, you might need to do additional. So that could be ultrasounds, that could be MRIs, especially if you have dense breast, which at least here in Connecticut, our laws say they have to tell you if you have dense breast, right?
Exactly. So now whenever you get your mammogram, they're going to report that to you, and then if you have dense breast tissue, then you may consider doing an MRI or additional ultrasounds.
Okay. If you find something on a mammogram, I know some people, that's their big thing that they're afraid of. What happens next?
Yeah, so a lot of times you'll talk with a breast surgeon just to develop that relationship, but they do need to investigate any imaging that they think is concerning. So sometimes that's close follow-up with more imaging in a few months, or sometimes it means a biopsy.
And as far as making sure that we can be proactive and maybe even prevent breast cancer, what do we know about things that can actually make a difference?
Yeah, so I always tell people the general things, just living a healthy lifestyle, but I also tell my patients to promote breast awareness. So that's just being very aware of your own breast shape, how it feels to you, how they look, and then if anything changes, it is important to talk to your doctor about that and don't feel shy about it, because they can do further workup. And then, like we mentioned, it's also helpful if you know a bit about family history, if anything changes, to also bring that up with your provider. And then lastly, it's super important to just schedule those mammograms and not miss your appointments, even if you feel well.
Yeah, and even if you don't have family history, it doesn't mean that you're not at risk, because we are seeing a huge increase, especially here in Connecticut. We have high rates in Connecticut.
For sure. Actually, most breast cancer is not genetic as far as we know, so it's super important to just keep up with those screenings, even if you don't have a family history.
So if you have a family history, you need to be extra vigilant, but if you don't, it doesn't mean you're in the
put
clear.
you off the table.
Okay.
Exactly.
And 1 in 8, I mean, those numbers are kind of, it's surprising and a little frightening. When you think 1 in 8, that's a pretty common number there.
Yep, I think, you know, most people have either been affected themselves or have a loved one who's been affected. So I think that's why it's so important for us to, you know, be vigilant. The research is going, and, you know, take it from there.
When you say healthy lifestyle, I want to dig in a little bit, because that means so much to different people. Obviously, you mean no smoking. What about alcohol use?
There has been a recent report about no safe level of alcohol, so really minimizing it as best you can is going to be the best for your general health and breast cancer health as well.
And exercise is important?
Yep, exercise can definitely be shown to help maintaining a healthy weight, you know, just being overall healthy.
Mm-hmm. And so at St. Francis, if you need a mammogram, if you're thinking, I haven't set up, I don't know where to go, I don't know what to do, you have people there who can help.
Yes, absolutely. We have a very well-trained center. It's a very friendly, warm atmosphere, and so we can definitely direct you with what to do.
Okay, and it's not painful. I mean, well, they squish a little, but it's not painful. It's non-invasive. You're just going to go, you're going to get it done, and then you're going to get results pretty quickly.
Yep, it can be a little bit uncomfortable at times, but everybody's a professional. They can really talk you through it, and then it's a huge, important step towards your health. And then we do try to get results back quickly, and
which is good
get you
to
reassured.
know. Yeah, I just got mine about a month ago, so every year we need to do it. My doctor always reminds me. So just like getting your teeth cleaned, well, that's twice a year, but every year after a certain age we should be doing this. So thank you, doctor, for being with us. We really appreciate it.
Thank you for having me.
And for more information at home, you can visit Trinity Health of ne.org/mammo. That way you can schedule yours. Just get it on the schedule.